Hi, my name is Caitlin, and today we'll be going over the proper technique for blood pressure measurement. To begin, let's take a look at one of the pieces of equipment used. What you see here is a sphygmomanometer. This is the instrument used for measuring blood pressure, and it's a rubber cuff that will be applied around the arm and is connected to a column of mercury with a scale that determines systolic and diastolic blood pressure. The first step in the process is choosing the correct size cuff for a patient. The cuff should be around 80% of the circumference of the arm, but there are markings along the cuff that show you whether the cuff is the correct size. You can also see a marking on the cuff that shows an arrow on where to align the brachial artery. Before taking a blood pressure reading, there are some protocols that should be followed. The subject should not have had any caffeine intake in the last 30 minutes and should have rested for at least 5 minutes prior to the measurement. The subject should be seated with their back supported, feet on the floor, and their arm elevated at the heart level as seen here. To begin, the blood pressure cuff is wrapped around the upper arm of the subject with the cuff about an inch above the crease of the elbow and the arrow aligned with the brachial artery. The stethoscope earpieces are pointed so that they face towards the bridge of the nose and placed inside the ear. The stethoscope bell is placed over the brachial artery and in the antecubital space and below the cuff's edge. The valve is tightened and the bulb squeezed, causing rapid inflation until the sphygmomanometer reads 200 millimeters of mercury. The pressure is slowly released at a rate of around 3 millimeters per second. The stethoscope is used to listen for the cough sound or a clear tapping sound that indicates the systolic blood pressure. From there is a swishing noise, then crisper and louder tapping, a blowing sound, and the last tap, which leads into silence and indicates the diastolic pressure. The values are noted and the pressure from the cuff is released. After the first reading, there should be at least a 1 to 3 minute break before a second measurement. Here you see the handy-dandy chart. This chart shows the standard for blood pressure measurements. A normal measurement is a systolic pressure of less than 120 and a diastolic of less than 80 millimeters of mercury. The values for pre-hypertension, high blood pressure stage 1, high blood pressure stage 2, and hypertensive crisis are also shown.